Good evening, everyone, and welcome to the multi-platform live stream from Get Fit and Be Lean. I want to thank you all for coming tonight and just getting a little bit of my lighting and everything set up. All righty. I'm Dr. Frank Cadle with the Get Fit and Be Lean program, and I would like to really extend my thanks to all of the folks from, all right, that's not gonna work. All right, he's a good dog, but he cannot help me live stream. Okay. I'm Dr. Frank Cadle with the Get Fit and Be Lean program that I used to lose over 20% of my body weight in 2021. I lost more than 5 inches off my waist. I lowered my cholesterol by more than 20 points. And I dropped my systolic blood pressure by more than 20 millimeters of mercury. I lowered my resting heart rate by about 30 beats a minute. I did all of this without any medications and their attendant risk of interactions or side effects. In fact, I was able to get off of my heartburn reflex medication. And I did it without surgery and its risk of complications that it can occur even years later. And I did it all on my TikTok platform day by day, showed almost every meal that I ate, showed pretty much every workout that I did. And I did it for a reason. I did it because I needed it, but I also did it because I wanted to try and carry a message that you don't have to go out and spend a lot of money on equipment. You don't need to have a bunch of supplements or cleansing teas. You don't need to join a gym. You can work out and eat a portion-controlled diet that is focused on fresh vegetables and fruits and a wide, varied diet. I didn't give up any foods. I didn't engage in any super restrictive 1,100 calorie day limits. And the reason that I wanted to do this is because it's clear that the fad diets that come and go, every couple of years don't work. The research is quite clear in Journal of the American Medical Association, the New England Journal of Medicine. They look at people over a 2-year period. Most of them gain 80%. 80% of them gain it all back, and some of them gain even more than they lost in the first place. All right, welcome Aggie, and welcome that 70, Amanda. All right, a lot of people. Do I drink alcohol? No, I do not, but I think that you can, and it's clear that a couple of glasses of wine are not going to hurt you. All right, I got a top 1 viewer. I don't know what that is, but thank you very much. And I really want to thank all of my YouTube subscribers. I never expected to have over 100 people on YouTube following me on this channel. This week, we're talking about dietary inflammation, and I've been posting some article links on my Twitter feed that I hope you will go and take a look at. I work really hard on trying to get kind of the bullet statement to cut it down to that tweet limit, and then have the link so you can look at the articles that I use when I make decisions about how I'm going to present this stuff. And this week, we're talking about inflammation and dietary impacts on inflammation. All right. Hello, Elle and the Prophet, Diane. Thank you very much. Good to have all you folks here. Thanks for the roses and stuff. Oh, man, we got 148 viewers there. Anyway, inflammation is obviously a scientific term, and it's important to recognize that it is a cascade, a biochemical series of things that happen inside our bodies, very, very complex. And I want you to understand that it is vital to life. Without inflammation, none of us would make it out of infancy. So for people to look for a dietary cure to inflammation is a little absurd. We do have medications that will eliminate a substantial amount of your immune system. People don't do well with that. We have to make sure ahead of time they don't have various diseases that our immune systems are designed to fight, like fungal infections, tuberculosis, cytomegalovirus. All of these things are things that when people go on anti-inflammatory immune suppressing drugs, they can really sustain some devastating infections, and they have to pretty much isolate themselves even more than we have been during COVID. So when people talk about, oh, you're going to stop all your inflammation, chronic inflammation clearly plays a role in disease and a whole panoply of diseases, including Crohn's and ulcerative colitis, degenerative neurologic diseases, maybe ALS, maybe MS, and cardiovascular disease. And this has been an area of my own special interest. So I've been learning about this for a long time. But, you know, even that, and even with all of the published literature that physicians use, just recently they eliminated that recommendation for people of normal cardiovascular risk to take an aspirin every day. And they had been recommending a baby aspirin for years, and it's still recommended for secondary protection. All right. Thank you very much. And I really appreciate all of the feedback that I get. So I hope that you'll make some comments on my videos. If you have any questions, I can answer them directly. It's harder to answer directly into the TikTok feed as I do these lives, because I'm also doing them on Instagram and YouTube and Twitter, just trying to reach as many people as I can. So one of my very faithful Twitter followers asked about food and inflammation. I posted an article today that was very good on looking at processed foods and inflammations in neonates and pediatric patients, and showing that the markers definitely increased. But, you know, trying to translate that into a clinical approach for the general population, still, we are years away from that kind of thing. Now, if you go back and you look at the foods that I ate over 2021, when I lost more than 50 pounds, you will see that I eat healthy. I mean, that's just the way I describe it. You can describe it any way you want. You can say whole foods. You can say, you know, I don't know. There's all kinds of catchphrases people like to use. I try to stay away from catchphrases. I don't find them terribly useful. But I eat the 2 veggie goal. That's my catchphrase. And that is 2 servings of raw or steamed vegetables at lunch and 2 servings at dinner. Most people get far fewer. What am I talking about when I'm talking about vegetables? When I ask my patients, what am I talking about when you think, what do you think of when I say vegetables? They say lettuce. Absolutely right. Lettuce is a leafy green vegetable, grows above the ground. And then typically they'll say tomatoes. And tomatoes are a berry. They have a thin skin. They contain seeds, and they contain the nutrients the plant puts there to help reproduce. So the tomato is a berry. And carrots are a tuber. They store starch for the plant underground. So this is not what I mean. I'm talking about leafy green, grow above the ground. And if you can only come up with lettuce and spinach, it's going to be really tough to get 2 servings at lunch and 2 servings at dinner. So you may have to find that you expand your vegetable vocabulary to include things like kohlrabi or asparagus and all of the different leafy green things that grow above the ground. I've had a number of videos on that. I do publish some recipes that I use on a pretty regular basis. But also berries have gotten a lot of focus on the antioxidant properties, and, you know, are supposedly one of those superfoods. I just like berries. I like the way they taste. I like to put them in my cereal in the morning. I like to have fruit salads. So these are things that are easy for me, but I think you will find that you can educate your palate to crave the things that are going to help you maintain. And what I really look for is satiety, things that make you satisfied when you eat them. And for this, the 2 veggie goal really helps, because you're talking about bulking up your food, and the bulk of your food is going to impact those stretch receptors that are activated when we are full. And with portion control and the 2 veggie goal, I was able to achieve a substantial amount of the weight loss that I needed to in just about 10 months, really. And I know that a lot of people out there need to lose a lot more. Now, if you want to lose 10 pounds in 2 weeks, Get Fit and Be Lean is not the place for you. I don't really have anything to offer you. If you're trying to get fit for summer bikini body or whatever, that's not really my focus. And the other thing is really not my focus. I don't want to pretend I'm not the longevity guy. Okay. If you want to take a look at Dr. Terry Simpson on TikTok, he does a lot of live videos. He's a very smart guy, and he really is an advocate for the Mediterranean diet. And, the Mediterranean diet has got some good literature behind it as far as longevity and cardiovascular disease. I just wanted to look better, feel better, fit into my smaller clothes, be able to do the things that I like to do. And this is why I combined a approach that is based on calisthenics, as well as an approach that I could do, even at my age, even with my limitations as far as time. I didn't want to travel anywhere. I didn't want to buy a bunch of equipment. And that's why I've done things the way I do. All right. No, I am not Mandy Patinkin. All right. Pyongyang. Holy cow. Somebody watching me from Pyongyang live. That's amazing. Welcome. I am not an attorney, and you better take that back. No, I'm a physician. I'm a licensed, board certified, residency and fellowship trained physician. I've been in practice more than 20 years. I have a degree in biochemistry and nutrition. So I've had this interest for a long time, and I've seen the impact that it has, obesity and poor nutrition, and what it does to people and their ability to not just live their lives, but to recover from the insults and the accidents and the trauma that can occur to any one of us at any time. And I've got to tell you, when you talk about the body positivity crowd and the fat and fit folks, they're not 60. They're not 70. Okay. They're 25. They're maybe 28, because you can carry that weight around when you're 25 and 18 and 28. And you can move and you can get up and down. You can do all the things you want to do. Well, around 35, 45, 50, increased incidence of arthritis, osteoarthritis. Your knees start hurting. You start people undergoing surgery at young ages, trying to put in new joints, and the ability to recover from that kind of thing is directly related to your size. And this is why I know it's really easy to demonize the body mass index and look at its origin and where it came from and how terrible it is. But surgical risks are easily and clearly associated with body mass index. Your ability to post-operatively recover from surgery, it's pretty much a direct relationship. So I'm not just doing this for me. I'm doing it for a selfish reason for me, and the fact that it's a lot easier to do surgery on people who are not morbidly overweight. With that, I'm going to go back here to my comments, see if I have any questions. I am right. Yes, I am right. Thank you so much. Relation to diet. Tell you about gout. Gout is a genetic predisposition to the formation of crystals in the urine and in the joints. And it's a pretty complex topic that's treated by urologists and sometimes orthopedists or nephrologists, because it can cause kidney pain and renal failure. I myself have had kidney stones, but I've never had gout. It's supposed to be one of the most painful things that people can undergo. All right, I'm going to kind of scroll back here and see what I missed. Quebec City, man, that is awesome. All right. Sounds like I was fasting. I was definitely not. So that's from Tony. And Tony, I definitely am not a fan of fasting. I like food. If you've seen my recipes and stuff, I eat food. I got overweight because I ate too much food. No, I was exercising portion control, and I was really trying to meet the 2 veggie goal. But beyond that, no, I don't recommend fasting. I'm not a fan of fasting. In fact, I posted something about inflammatory markers and fasting just this week on my Twitter account. You can take a look at it, and it shows that actually the inflammatory markers went up in the fasting group. So this whole thing that they try to propose, it's some kind of key to everything. It's not. All right. Yes. Thanks for the beard comment. I appreciate that. Am I a doctor? I'm a DO, doctor of osteopathy. And I went to an osteopathic medical school. Do I like chicken? I eat chicken all the time. All right. Pull ups, push ups, dips, running. I haven't done the dips because I was really at quite a bit of weight when I started this. I could do the sit ups and the push ups. I do incline push ups now. Haven't done any pull-ups. It's pretty hard on the shoulders as you get older, and especially when I started this, I was well over 200 pounds, 250 pounds. But I am a fan of anything that you can set up to do at home. There was a really interesting piece on National Public Radio this week, and they talked about the increased recommendation for exercise, and they're talking an hour a day, 6 times a week, and that's tough to do. And one of the guys talked about how hard it is if he tries to do it at the gym, and he ends up having to go to the gym. It's like 20 minutes to get there and get ready. And then it's another, it just adds, it almost doubles the amount of time. So I really wanted to recommend calisthenics and to show people me doing calisthenics at my age, just to know that you can adjust them to your own abilities. They don't require any equipment, any enrollment, any subscription. You don't need any membership anywhere, and you can start today. And if you want to go to my TikTok account and scroll all the way back to January 1st, 2021, you can look. I could barely do maybe half a dozen sit-ups, 5 push-ups, and maybe a dozen jumping jacks. But I did them every other day. I did them 3 or 4 days a week. Eventually, I was able to increase to 5 or 6 days a week. I started adding other exercises like deep knee bends and leg lifts and other flutter kicks and stuff to work the back until I was working every major muscle group in the body. So, that's excellent from Tom. I really like to hear that you're doing the calisthenics. And Stan, anastomosis king. I don't know that I'm the king, but I'd make a pretty good anastomosis. All right, tomatoes or onions. What I really like is the tomatoes and the onions and squash, and you can put them in a layer and use the tomatoes to kind of steam the onions and the squash. A little bit of Lowry's seasoned salt on that. That's a delicious meal. So I like them both. On your 6th booster, I don't think you should do that. I think it is specifically recommended not to do that by the CDC. Okay, got the vaccine several times. No, it's not better to be safe. You're maybe taking it from somebody else that could have used it. There have been shortages. All right. Yeah, quit doing that. Don't do that. Just take your 2 vaccines and your boosters, and that's good enough. All right. You don't believe in inflammation, then I would recommend that you make a small cut on the back of your hand and rub it in the dirt. And you will see that you develop inflammation. It gets red, it gets inflamed, it gets pussy, and inflammation is a real thing. So without it, you wouldn't have made it out of infancy. Are SSRIs harmful? I am not a psychiatrist. I don't prescribe those medications. I don't recommend for or against them, but I do recommend if you think you might need them, you see a psychiatrist. Do not do your medical treatment on the internet. All right, I got 5 new messages. Calisthenics, excellent. I am a big, okay, so PVD. PVD, I don't know about serious, but there just may not be much they can do for it until it's at a more advanced stage, other than control your risk factors, which are your cholesterol, your blood pressure. Don't smoke. Peripheral vascular disease is a particular interest to me as a vascular surgeon. However, that's not really the focus of the Get Fit and Be Lean program. But if you pursue the kind of foods that you see me eat and you don't smoke, your odds of getting peripheral vascular disease, as long as you don't already have it, are going to be pretty well normal. All right. Cryolipolysis is sculpting. It's just like liposuction, only with a little more advanced technology. And it's got nothing to do with weight loss. It's got nothing to do with nutrition. I don't really get into it because it's just not my area of expertise, and I'm not going to go out and get that done. I am going to talk a little bit about excess skin in an upcoming video that I'm going to post, because I was asked by one of my followers about that. And surgical resection is the only way to deal with that when it's extensive as a result of extreme weight and then weight loss. And it really doesn't matter the time frame unless you're quite young. You're going to end up with some loose skin, and the only way to get rid of that stuff is surgery. All right, so why do we get fatter as we get older? Actually, there's just been some research published about the resting metabolic rate in adults as they get older, and there does not appear to be any clearly ascribable to age change in your metabolic rate. The reason most people get more obese as they get older is because they eat too much and they're too sedentary. And, if you can't get out and walk aggressively, then maybe try aqua aerobics, something that you can use the water to suspend your body up off your joints while you maintain movement. Okay, so swelling in the knees over 54, most likely is, fusion in the joint from osteoarthritis. But if you get swelling in the ankles, that's more likely edema at that age. Once again, I'm not an internal medicine specialist. I don't try to carry that kind of information out on the internet, because you deserve your own physician who diagnoses you and treats you for those diagnoses based on your medical history. Don't try to do that stuff over the internet. It makes me crazy when people try to, come out on the internet and say, oh, this is the answer to your problem. That's not medicine. So the scan for calcium in the arteries, I got to watch that actually kind of be developed and come more into the mainstream. It's a pretty good way to kind of get an idea of what your overall cardiac risk factors are, but we know a lot of things about that already, and it doesn't replace traditional angiogram or anything for looking at the actual vessels. So it's an interesting opportunity to kind of get a picture of how much calcified arterial vessels, and the reason they're calcified is because of inflammation. And the inflammation started years before you see that calcification in the artery wall. The calcification is a late stage development of the inflammatory process that begins with endothelial injury in the artery. So the injury occurs, and then the inflammatory response begins. And that's really what develops the plaque, and the eventual rupture is what causes occlusion and heart attacks and that kind of stuff. So inflammation is really an important part of cardiovascular disease, degenerative joint disease, but you are unlikely to control all of that just by eating some cucumbers. So that is the disease that I want to carry today. I mean, that's the message that I want to carry today. Holy cow, we still got 90 viewers on Instagram. That's about the longest I've ever had that many viewers. So, enjoying hearing myself talk. Well, I'm talking and answering people's questions. So, I do enjoy answering people's questions. So, turmeric is really getting a lot of attention and appearing to show some pretty significant success in controlling inflammation. And that is, I'm really not a big one for supplements and all that stuff. If you've listened to me, you've heard me talk against going out and spending a bunch of money on cleanses and all that powders and teas. But turmeric really looks like it may have some pretty significant benefit. And so, but before you start on any of that stuff, I would recommend you talk to your physician. Okay. Not even reading the comments. You see, I have the comments on a separate tablet here, and that's where I'm reading the comments. So I'm sorry you're confused about that. And Yes, doctor and a plumber too. Try to make the stuff flow. Yeah, Decadron for asthma. That's a good indication that they're trying to control the inflammatory response to environmental exposure to dust and smoke and pollen. And it really has a lot of side effects. And this is why when you see these influencers and chlorophyll drop hawkers talking about we're going to shut down the inflammation, that's not necessarily a good thing. Okay, when we really shut down people's inflammation, it has a pretty significant collection of side effects and problems. All right, well, this is really one of the biggest lives I've ever held, especially as far as my TikTok folks. I try not to really pass too much judgment on people's questions. Everybody's coming from a different direction and a different educational background. I'm lucky in that I have a really broad educational background. So, some engineering, some biology, some chemistry, some history. But not everybody has that experience. And I really want to try to be open to questions. And I try not to ridicule people for questions, even if they seem elementary to me. That's not my role as a physician or an internet creator. I don't want to ridicule people, and I'm not trying to start any controversies, even though that appears to be the pathway to internet success. That's not something I want to do. So I hope you'll stay tuned for my 7:30 p.m. Pacific live streams, and I hope you'll check out my Twitter feed, because I really do try to get articles for you guys that you can see where I come up from with this stuff. I don't just make it up. I really get it from New England Journal of Medicine, Journal of the American Medical Association, Lancet, British Medical Journal. I try to go to really authoritative sources. So thank you very much, everybody, and it's really been good to have you here. I'm going to sign off. Any more